We are going to be with COVID for several more years. That's a reality. It's not going to go away. It's going to be around and it's there in the community. COVID can affect anywhere, basically head to toe. Eye-opener for us that we are focused on lungs, but it is affecting our heart also. Because if it affects your walls, if it affects your muscle, then down the road you're going to develop weak cardiac muscle, cardiomyopathy, and heart failure.
Hey everyone, welcome to DARPin Dialogue. Well, we're kind of going to break down as to what's happening with some of the latest developments in relation to COVID-19. To join us on this discussion, we've got Dr Pargat Singh Bhurji with us. So let's say hello to him. Hi, Dr Bhurji, how are you?
Hello, and thank you very much. And you're doing a great job educating people about COVID-19, which is our time's biggest pandemic we have seen.
Yes, absolutely. There is a study that has come out. When I saw it, I thought it was definitely a little concerning. So there were, according to the study, individuals who, after recovering from COVID, have experienced heartache. So tell us a little bit about that study.
Well, it was a big surprise because we say this is a virus which affects the lungs. And these were people who were previously healthy in their 40s and 50s. And when they went for the regular checkup in about 2.5 month to 3 month time, the study is done in Frankfurt and it's a proper study done in Germany. They found that a lot of them, they have structural findings which shows inflammation, that there is swelling. And the heart has also gone through COVID infection, it looks like. Now, traditionally we do echo, which is an ultrasound of the heart. If we do echo, these findings will be missed. But these were picked up on doing MRI, cardiac resonance magnetic imaging. And these are eye-opener for us that we are focused on lungs, but it is affecting our heart also. Because if it affects your walls, if it affects your muscle, then down the road you're going to develop weak cardiac muscle, cardiomyopathy, and heart failure. So this is not a simple infection, just like influenza with lungs. So this can affect your heart also. So basically in our chest, we have 2 lungs, 1 heart. So the whole chest is affected. COVID can affect anywhere, basically head to toe. So right now we are finding, as the studies are coming, countries who went through this phase before us, they are releasing data. From Cleveland, America also, they have brought up what is called broken heart syndrome, which almost 50% of the people who have recovered from COVID have shown that their heart structure and function decreases. In the Frankfurt study, almost 68% had those findings, and these are previously healthy people.
Right.
So this is something which is not simple. So we have to stay away, do 6 or 8 feet of physical distance, hand hygiene, mask when we're going out, and the virus is not going to go away. It's going to stay here. We have to learn how to deal with it.
The study that you've just mentioned, the heart damage, and yes, very surprising findings. Do you expect more studies like that to come out?
Absolutely. The study will come out in the US also, Canada also. Any country which has dealt with COVID will publish their studies. With the lungs also, there is chronic injury. 20% of the people, they're using puffers, they're using home oxygen. It also affects the blood vessels in the lung, causing microclots and fibrosis, means scarring in the lungs. So this virus is much more than what we thought as a simple flu. So be careful, be cautious. Your summer can wait, but if you get infected, your chances of ending up in the hospital goes up.
Right.
It can affect any age. I agree that in youth and children and in adults, it's not causing much damage, but we will never know who will get to the hospital.
How far are we into the global race when it comes to vaccine?
Different countries are claiming different news, but what the WHO wants is proper trials. So 2 companies are on phase 3 trial, which are Moderna and the Oxford. So right now there are 23 recognized clinical trials going on, and 7 of them they're already in phase 3, but the previous one I talked are in the lead. Now when they talk about the phase 3 is taking larger group of people. somewhere between 30 to 50,000. Different age group, different ethnic background, different disease condition, different immune system, and then watching what the vaccine actually does. Does it give protection? What are the side effects? For how long does the immunity last? So these trials will be completed hopefully in the next few months, but to synthesize the data and to bring the news will be several more months. Now, the vaccine is not the silver bullet, as our federal health minister and our chief medical officer federally, Theresa Tam, has said, because we at this stage don't even know how effective the vaccine would be, whether it will totally prevent COVID or not, whether it will decrease the severity so that they don't go to the hospital. Whom should we give first? That's the challenge. So our concern as a medical faculty is at-risk population, people working in the forefront, doing COVID care. Do we need to give second dose? Would this be a yearly vaccine just like influenza or flu vaccine? So those are some questions. But we are going to be with COVID for several more years. That's a reality. It's not going to go away. It's going to be around and it's there in the community. With holidays in BC, the numbers have gone up from traditionally 10, 12 to about 40s, sometimes 50s, because people are moving, people are merging. And the youth, they're not following the social distance, mask, sanitizing and things like that. So those are the real facts about COVID at this stage.
Okay, so interesting you pointed out some of the challenges that we're facing with the numbers going up. However, it seems like the hospitalizations, they're on a downward trend. The numbers were somewhere in the area of 6 to 7 last week. So just wondering what could be the factor there that the spike in cases is there, but the hospitalizations seem to be on the lower side?
Interesting and good observation. The reason for the cases which went up is young adults and youth.
Right.
And traditionally, they don't get very sick. That doesn't mean that they cannot get sick. So when we play with fire, a lot of time we don't get hurt, but sometimes we get hurt. So that's why the numbers in the hospital are low, because the previous curve which we saw mainly affected people who were 60 plus in residential care home and people with compromised health with high blood pressure, diabetes, obesity, immune disorder, and they who were on multiple medication. Now globally, we are crossed 18 million. America is touching 5 million cases. India is touching 2 million right now.
Yeah.
Brazil is 2.5. Russia is close to 2 million. We are in a better situation because we have universal healthcare system. We have observed that countries like Canada, Australia, New Zealand, Singapore, Taiwan, South Korea, Japan, where there's universal healthcare, COVID care has been good. It has been better and the outcomes have been great. The best is to get yourself protected, be safe and be courteous, be careful, be mindful, stay locally, don't roam around too much, don't go on long trips, don't go on long vacation, but together we can keep the curve flat and we can prevent second wave, or we can deal with second wave in a very effective and humane way.
Wonderfully said. Thank you so much for that final message. Truly appreciate you taking the time with us.
Thank you very much and God bless you. Hopefully we will be in a position to give you much more healthier and jovial news.
Follow us on Facebook, Instagram, Twitter, and YouTube. Like, share, and subscribe.